Throat cancer, a diagnosis no one wants to hear, but being informed can make all the difference. Throat cancer symptoms can be hard to spot early on. Since throat cancer is a type of head and neck cancer, its symptoms can be similar to those of a common cold. In this video, we're delving into the 7 signs and symptoms to watch for. Understanding its signs and symptoms can truly be life-saving. Let's jump right in. Firstly, what exactly is throat cancer? Throat cancer is any cancerous tumor that grows in your throat or your voice box. Your throat, or pharynx, is muscular and starts behind your nose and stops in your neck. Your voice box, or larynx, is right under your throat. It's made of cartilage and contains vocal cords that allow you to speak. About half of throat cancers happen in the throat itself, while the other half start in the voice box. Usually, cancer in your throat starts in the flat cells that make up your throat lining. These diseases tend to grow quickly. That's why getting diagnosed and treated early on gives you the best chance to get rid of the cancer and keep a good quality of life. Learn as much as you can so you'll know what to expect. Understanding throat cancer means knowing that it can come in different types and stages. Throat cancer can show up in different parts of the throat, like the pharynx, where your nose connects to your throat, or the larynx, your voice box. Pharyngeal cancer can happen in different spots in the throat, while laryngeal cancer focuses on the voice box. Stages. When doctors talk about stages of throat cancer, they're figuring out how far the cancer has spread. Stage 0 means there are weird cells in the throat that could turn into cancer. Stage 1 means the cancer is small and only in the throat. Stage 2 means the tumor is a bit bigger but hasn't spread to other parts nearby. Stage 3 means it's larger or has spread to nearby lymph nodes. Stage 4 is the most serious, where the cancer has spread to other parts of the body. Knowing about the different types and stages helps doctors decide how to treat it and how likely it is that treatment will work. So, if you're worried about symptoms of throat cancer, it's really important to see a doctor as soon as you can. Catching it early gives you the best chance of getting better. So what are the signs and symptoms to watch out for? Let's dive into the 7 important symptoms of throat cancer. Remember, awareness is key to early detection. Symptom number 1, voice changes. Changes in your voice, like it sounding rough, shaky, or strained, could happen if there's something wrong with your throat. It could be due to a growth or swelling that's affecting your vocal cords. Getting your voice checked by a doctor is important, especially if the changes don't go away. Symptom number 2, trouble swallowing, chewing, or breathing. Finding it hard to swallow, chew, or breathe normally could mean there's something blocking your throat. This blockage might be because of throat cancer, where a tumor grows and gets in the way. It's essential to pay attention to these difficulties, especially if they don't get better over time. Symptom number 3, feeling of something caught in your throat. Constantly feeling like there's something stuck in your throat, even when you swallow, could be a sign of throat cancer. This sensation doesn't fade away, even if you try to clear your throat by coughing or drinking water. Symptom number 4, persistent sore throat, cough, or earache. While occasional sore throat or cough is common and typically benign, persistent symptoms lasting for an extended period merit attention. Throat cancer can present with symptoms such as a chronic sore throat, persistent cough, or even an earache that fails to resolve with conventional treatments. It's important not to dismiss these symptoms, especially if they persist or worsen over time, and to seek medical advice for further evaluation. Symptom number 5, neck lump or soreness. Discovering a lump or feeling of soreness in your neck that doesn't disappear could be a sign that the glands in your neck are swollen. Swollen glands might indicate that cancer has spread beyond your throat. It's crucial to have these symptoms checked out by a medical professional. Symptom number 6, unexplained weight loss. Losing weight without trying could be a red flag for various health problems, including cancer. If you're shedding pounds unintentionally and you're not sure why, it's important to see a doctor to investigate the cause. Symptom number 7, bleeding in mouth or throat, loose teeth, or ulcers. Keep an eye out for any bleeding in your mouth or throat, loose teeth, or sores that won't heal. These could be signs that throat cancer has reached an advanced stage and requires immediate medical attention to determine the cause and start treatment. A person with cancer in the lower part of the throat, or hypopharynx, may not have symptoms in the early stages. This can make it harder to spot. Other conditions can cause these symptoms. Remember, while these symptoms can be alarming, they can also stem from less serious conditions. However, it's always better to err on the side of caution and consult a healthcare professional if you experience any of these signs for an extended period. Now that we've discussed the signs and symptoms of throat cancer, Let's delve into the risk factors and how we can take preventive measures. First and foremost, quitting smoking and limiting alcohol consumption can dramatically reduce your risk of developing throat cancer. Seek support from loved ones or professional resources to help you kick these habits for good. Embrace a healthy diet rich in fruits, vegetables, and whole grains. These foods are packed with antioxidants and essential nutrients that support overall health and strengthen the body's defenses against cancer. If eligible, consider getting vaccinated against HPV. Vaccination not only protects against cervical cancer, but also reduces the risk of HPV-related throat cancer. If you work in an environment where exposure to harmful chemicals is possible, always use protective gear and follow safety protocols to minimize your risk. By understanding the risk factors and taking proactive steps to prevent throat cancer, we can safeguard our health and well-being. How do you prevent throat cancer? There is no proven way to prevent throat cancer. However, there are certain preventive measures to reduce the risk. Limit the use of tobacco products and smoking, eat a healthy diet low in saturated fat and rich in fruits and vegetables, and go for regular dental checkups as well as health and cancer screening. The survival rate for throat cancer depends on the stage of cancer, the type, and where it occurs. Experts use past statistics to calculate a 5-year relative survival rate, which is an estimate of the likelihood a person will live at least another 5 years after a cancer diagnosis. That wraps up today's video on identifying throat cancer. Stay informed, stay proactive about your health, and don't hesitate to seek medical attention if needed. Thanks for watching, and we'll see you next time.